Hi there, my name is Kelly and I'm here to educate you on amphetamine use. My hope is that by the end of this informational video, you will have a better understanding on how amphetamines can affect the body and also know the risks and consequences of amphetamine abuse. Amphetamines are central nervous system stimulants that affect chemicals in the brain and nerves that contribute to hyperactivity and impulse control. Amphetamines are most commonly used in medicine in the treatment of ADHD, narcolepsy, and obesity. Amphetamines and other stimulants are used in sports for performance enhancement. Athletes who abuse stimulants often believe they run faster, jump higher, and have more power when they use. As a stimulant, the effects on the nervous system are an increase in blood pressure, an increase in pulse rate, insomnia, loss of appetite, and physical exhaustion. The effect amphetamines have on the mind are similar to cocaine, with a slower onset and longer duration. In contrast to cocaine, amphetamines are metabolized slowly by the body and remain in the central nervous system longer. As a street drug, amphetamines are usually seen as different colored powders, but can also be in pill or paste form. Common street names for amphetamines are uppers, wake-ups, meth, crank, and ice. The purity of recreational amphetamine is very low. Commonly, the powders are composed of glucose, vitamin C, laxatives, powdered baby milk, caffeine, and aspirin. Like most drugs, the method taken determines how quickly and how intense the effects will be. If swallowed, the effects come on slower and are less intense. If snorted, smoked, or injected, however, the effects are quick and, depending on the dose, can be intense. Amphetamines are considered a Schedule II drug, which means they have a high potential for abuse and limited medical uses. Pharmaceutical products are available with a prescription that cannot be refilled. Penalties for possession of amphetamines include a maximum sentence of 7 years imprisonment and a fine. For supply and production, maximum sentence can include life imprisonment. Common prescription amphetamines include Ritalin, Adderall, and Dexedrine, and are most commonly prescribed for the treatment of attention deficit hyperactivity disorder, or ADHD. Chronic abuse of amphetamines produces a psychosis resembling schizophrenia. Paranoia, picking at the skin, preoccupation with thought, and auditory and visual hallucinations are common characteristics of abuse. Violent and erratic behavior is common among abusers. The effects of overdose include agitation, increased body temperature, hallucinations, convulsions, and death. Globally, methamphetamine is the second most commonly used illicit drug after cannabis. Amphetamine use is gaining popularity in the college setting, in athletics for an energy booster, and in academia as a method of focusing. This is dangerous because it normalizes the exchange of prescription drugs between college students, creating a use, misuse, and abuse cycle.